Looking at the vessels of the head and neck, we can see here in the neck the common carotid artery running parallel with the internal jugular vein. So one's taking blood up to the head, and the other's draining a lot of blood from the head. Now there's an anterior and external jugular as well, but this is the largest, and it runs right alongside the carotid arteries here. If we zoom in just a bit tighter, we can see that the carotid arteries are going to have a split. So the common carotid artery splits to become the internal carotid artery here, which is going to travel to the brain, and the external carotid artery, which gives off multiple branches. Now these are not screamingly obvious in this model, but we've got a superior thyroid, a lingual, a facial, and further up here the two terminal branches, the superficial temporal and the maxillary artery there. Let's take a look now at the vessels of the brain itself, coming from the internal carotid artery. The brain receives blood from the internal carotid arteries, but also the vertebral arteries, and one thing to note about this model is it doesn't actually show us the vertebral arteries at all. So they'd be here, fusing on the midline to become the basilar artery, and supplying the brain stem, and also making the posterior cerebral artery here. So we usually are going to have 3 cerebellar arteries and 3 cerebral arteries. Now this model is showing us the internal carotid artery coming in here, just alongside the optic nerve, and it's going to give off a branch that goes anteriorly, a branch that goes posteriorly to communicate with the posterior cerebral artery, and a large branch going laterally. That lateral branch is known as the middle cerebral artery, and it's most of what we see here on the lateral side of the brain. So it's covering a large portion of the temporal lobe, the parietal lobe, and the frontal lobe. More posteriorly, we have the posterior cerebral artery. That's going to be taking care of the occipital lobe, and we can see that represented here on this medial side as well. So PCA, or posterior cerebral artery, takes care of the occipital lobe, whereas the anterior cerebral artery, just here, coming off the internal carotid, is going to supply the medial aspect of both hemispheres. So the right one gives off right branches to the medial side of the right hemisphere, and they're going to peek out over the top of that interhemispheric sulcus a bit, but they're going to be largely supplying blood to medial structures here. Now, back to the model itself, and off of the removable brain part, we can see that they have actually shown the vertebral artery here, not attached to the brain and brainstem itself. So you can see the vertebral artery coming in here, and the vertebral artery is going to travel up, and it's going to meet the corresponding vertebral artery from the opposite side to form the basilar artery right here in the midline in front of the pons. Before it does so, it gives off the anterior spinal artery there. It's also going to give off a posterior spinal artery that's not represented here. Then as we travel up the basilar artery here, it's going to dead end at the posterior cerebral artery. We've got this superior cerebellar artery here. We have the, I think, right here, anterior inferior cerebellar artery, and then the posterior inferior cerebellar artery here. Note that we also have a branch going to the inner ear, and right up here we've got our internal carotid artery, sort of kind of completing that circle of Willis just there. So blood makes it to the brain, but then it's got to get from the brain down to the rest of the body again. And it does so by draining through cerebral veins, and those cerebral veins are largely going to wind up draining into dural venous sinuses. These are hollow spaces inside the dura mater that are full of blood, and you can see these little red dots marking where the blood is entering. So the blood is going to drain through this superior sagittal sinus. It's going to have blood from an inferior sagittal sinus meet it and go through a straight sinus here. And this spot where they come together is called the confluence of sinuses. Now thereafter, the blood is going to drain transversely, so it's actually going to go around the side and then down through the temporal bone to become the internal jugular vein, which we saw a little earlier just here. Now that we've seen some of the models of the vessels of the head, neck, and brain, let's actually look at some schematics of these drawn in with their branching pattern as the focus. So starting in the neck, we have the common carotid artery splitting into the internal carotid artery, which will head up towards the brain, and the external carotid artery, which has many branches, not all of them represented here, going to the neck and the face. We have a superior thyroid, a lingual, and facial artery coming off anteriorly, and then a posterior auricular and occipital artery going posteriorly. The external carotid artery ends as it branches into a maxillary and superficial temporal artery, taking care of structures on either side of the jaw. Moving into the brain pan, we can see the underside of the brain here. And the main thing to note is that we have a large network of vessels on the base of the brain getting their input from two different sources. The first is the right and left internal carotid artery. I've only shown one here, but the other one is colored in right there. It's going to branch into an anterior cerebral artery on both the right and left, and they will be connected by an anterior communicating artery, little short branch right there, keeping the two together. The other branch of the internal carotid artery is the middle cerebral artery. Now it's going to go in between the temporal lobe here and the frontal lobe, so that's why it's colored in a little bit of a hatch mark here, but we can see it's cut there, but on this side we're showing some of the branches going to the frontal lobe, the temporal lobe, and the parietal lobe. We'll see a little bit better depiction of its spread in just a bit. But that's the main output of the internal carotid arteries. The other inputs to this system are going to be the right and left vertebral arteries coming up from around the vertebra into the spinal canal as it turns into the brainstem. They're going to give off an anterior spinal artery as well as two posterior spinal arteries that are not shown here. But the vertebral arteries give off a posterior inferior cerebellar artery, which name pretty much tells you where to expect to find it, and the basilar artery is going to be formed as the two vertebral arteries come together. It's going to give off an anterior inferior cerebellar artery. Here we have a small labyrinthine artery on each side that's going to go to the inner ear, going to be supplying structures there, and the basilar artery then has a nice long stretch in front of the pons before it gives off the superior cerebellar artery. So we have three cerebellar arteries all coming off the vertebral basilar group of vessels here, and the basilar artery ends as it splits into the right and left posterior cerebral arteries, which are going to take care of the occipital lobe and a bit of the underside of the temporal lobe. Now, those two systems, the vertebral and basilar, as well as the right and left internal carotid arteries, are connected by two small posterior communicating arteries, and that forms a circle at the base of the brain known as the circle of Willis, or the cerebral circle. Taking a look at the lateral view, we can see the branching of the middle cerebral artery a lot more clearly. Internal carotid artery comes into the circle of Willis, and one of its main branches is the middle cerebral artery, which is going to pass through the lateral fissure here and give off vessels that are both going to the temporal lobe here, inferior branches of the middle cerebral artery, as well as branches going to the parietal and frontal. So we have some superior branches there. So the majority of the lateral side of the brain, excepting the occipital lobe, is going to get its blood supply from the MCA, the middle cerebral artery. Note here we've also got our vertebrals coming in, giving off the posterior inferior cerebellar artery, or pica, fusing to become the basilar, which gives off the anterior inferior cerebellar, and I didn't bother coloring in the superior cerebellar because the top of the cerebellum is completely obscured in this image. Here on the midline, we can see that the internal carotid artery also is going to give off that anterior cerebral artery. And one thing to note about it is it actually supplies a huge amount of the brain medially. So it's going to give off a lot of vessels that go to the frontal and parietal lobes, medial aspect, as well as over the top of the ridge here just a little bit. But we have to back up to the vertebral system to find how the occipital lobe gets its blood. And that's going to be through the vertebral arteries. Once again, pica, posterior inferior cerebellar, coming off of it. Then the basilar gives off the anterior inferior cerebellar, labyrinthine, and superior cerebellar arteries going to the brainstem and cerebellum. And then finally, as it ends, it gives off the posterior cerebral artery. And here we see its medial branches, but there would also be some lateral branches going to the outer aspect of the occipital lobe. So once again, PCA, or posterior cerebellar artery, is the majority of the blood supply to the occipital lobe. Well, if we have blood supply to an organ, we have to have blood from the organ. And in the case of the brain, we have multiple cerebral arteries on the surface of the brain draining the blood from it, and they are going to coalesce into vessels that travel into these interesting vessels called the dural venous sinuses. And these are actually not standalone vessels, but they're actually inside the dura mater. Right between the right and left hemispheres, we have the superior sagittal sinus inside the dura mater with blood vessels moving into it called bridging veins that leave the surface of the brain and travel into that sinus. And blood in the superior sagittal sinus drains posteriorly, a little bit more inferiorly at the bottom margin of the falx cerebri, the dura mater, is the inferior sagittal sinus. There's a large cerebral vein, or great cerebral vein, draining blood from this area, and when it and the inferior sagittal sinus come together, they form the straight sinus, which rockets back here, and when it meets the superior sagittal sinus, it forms this big chamber called the confluence of sinuses. Now, these structures are all on the midline until we get to the vessels that follow from the confluence, and that's going to be a right and left transverse sinus, colored in just the left side here, and we can see it wraps around, goes behind the cerebellum and brainstem here. If we color this from the outside, superior sagittal sinus, once again, drains blood right on the midline between the hemispheres. We have the inferior sagittal sinus meeting the great cerebral vein to form the straight sinus, and these come together with the superior sagittal sinus at the confluence of sinuses, and at that point we have a right and left transverse sinus. Now the transverse sinuses do what you'd expect. They're traveling transversely around the skull, but then they make a little bit of an S-curve and exit the skull right around here. This is called the sigmoid sinus, and it's going to give rise to our internal jugular vein. Now here's a ventral view, and we can see, if you squint, the vessels here. We have the confluence of sinuses right on the midline, draining to a right and left transverse sinus, which will then end as a right and left sigmoid sinus before becoming the internal jugular vein. And now we're back in the neck. So once again, let's take a look at those sinuses. Once again, the same ones we just talked about, but here's the sigmoid sinus exiting a hole in the skull, actually called the jugular foramen, to become the internal jugular vein. And if we think back, remember that the internal jugular vein meets the subclavian vein to form the right or left, depending on which side we're on, brachiocephalic vein. In addition to that, we have blood drainage coming from the face. There are many, many veins in the face and the head and the neck, but posterior to the jaw, we have a very large retromandibular vein. It's going to get blood from internal structures via kind of a very complex structure called the pterygoid plexus of veins. We won't worry too much about that, but just know there are other sources of venous blood draining into the system. There's a nice long facial vein, and when the two of these meet, by most of the time, veins have a very variable way of forming, but most of the time when these two come together, we refer to it as the external jugular vein. And it's called that because it's on the outer surface of the sternocleidomastoid. So external jugular vein is external to the sternocleidomastoid, whereas the internal jugular vein is deep to it. The external jugular vein, as well as another more anterior jugular vein, both also drain to the right or left brachiocephalic vein as well. And once again, there's extremely wide range of variability. Sometimes you have very large anterior jugulars and very small external jugulars. Sometimes you have the opposite. Sometimes you don't even have a demonstrable anterior jugular vein. Any kind of variation can occur in this system, but this is a fairly decent consensus. I'm looking at it from the front. Once again, internal jugular vein and subclavian vein meet to form the brachiocephalic vein. The facial vein and retromandibular vein will form the external jugular vein, which is going to drain to the brachiocephalic vein along with the anterior jugular vein. Again, some variability in exactly what pattern this takes. But then we're at the right brachiocephalic vein, which joins the left brachiocephalic vein, forming the superior vena cava, taking deoxygenated blood back to the right atrium of the heart, putting us right back where we started in this course.